side. The horse bangs this against the skull wall, big swelling there on the hock. It's called capped hocks. Inflammation of the calcaneal bursa. Now, what I want to point out is that the superficial digital flexor passes over and continues. These gastrocnemius muscles terminate on the calcaneal bone here. That being the case, the superficial has to kind of spiral around those two tendons, and you put all that spiraling around and add some contributions from the biceps femoris here, and you get this thing called the common calcanean tendon. Common meaning it's got all of those elements in it. Superficial digital flexor will spiral around it so it can get on the outside here and then head right on down where it should insert. Now we take the other component now. We still need to do this with the digits, and look against the bone, and you see the remaining muscles there, which have names. And we're just going to collectively call them the deep digital flexor. There's a caudal tibial, and there's a medial head, and the biggest head is the lateral head. Right against the bone, we follow those down, and they don't pass over the tip of this. They pass medial in a big groove here called the sustentaculum tali. Follow that down. Now that tendon is underneath the superficial, and when we get to the end of the line here, we get to phalanx 2, superficial stops, and deep has to continue. And when that occurs, then the deep passes through a structure built by the superficial digital flexor, and that structure looks like handcuffs or manacles. That's where the word came from. That's that Latin stuff again. And that's a flexor muscle. So this tube formed by the superficial digital flexor that deep digital flexor passes through is the manica flexoria. And we saw similar structures in the foreleg. Well, we were supposed to. Maybe we did, maybe we didn't. But that's where the term manical flexoria comes from. Manacles are handcuffs, and that arrangement there is kind of like it's handcuffing the tendon. Now, what other muscles are there to consider here? When you look in between the bones here, the reason I can do that with my hands is because there are muscles between the bones here called interossei, potato. Anyway, so we're just going to collectively say any other muscles you see down here for our purposes are interosseous muscles. Horse people, next semester, that'll be incredibly important, and the dog people will be learning stuff the horse people already know. The interosseous muscle in the horse is a really important structure, and quite large. Okay, have we run out of muscles? I think we have, haven't we? Have we run out of nerves? I think we have, haven't we? Run out of muscles, run out of nerves. We've done some ligaments here. We talked about menisci. The only thing we haven't done are vessels. We hate vessels. At least we appear to hate vessels, because everywhere I go, I don't see many. But I know you guys are working away. So
Ours don't look like that.
Yeah. So listen, let's look at this first, and let's do the easy course. We're talking pelvic limb. So on the pelvic limb here, after we emerge from the body and that vascular triangle, the main blood supply to this limb is supplied by the femoral artery, and it's pretty big there. Now, if you follow that down, then you can see, yes, there are some branches off of it, and dang it, they probably have names, and they do. I'm going to say a couple of them, but I'm going to hold you for the fact that there's a femoral artery, and underneath this surface, subcutaneously here, there's going to be a vessel that's going to head down this way that's part of this mess, and that will be the saphenous artery. It'll be accompanied by a nerve and a vein. Saphenous artery, nerve, and vein. Subcutaneous vessels in dogs, cats, aardvarks, everybody else I can think of. And the saphenous is an extension of that femoral artery. Now, that being the case, what about this one? What about that one? What about that one? Well, I want you to consider this femoral artery, and yes, this is probably the proximal caudal femoral, and it's named because it's proximal and it's caudal in terms of its supply, and it's part of the femoral. Come down here and deep to this thing, there'll be a middle caudal femoral, And then what happens to this vessel? Well, after it gives off one that goes to the knee, genuflex, the descending genicular, comes down here to supply the joint. See why we don't care about all those names? Because it's too hard to remember. Now that femoral artery now dives deep and goes behind the stifle. And behind the stifle is too easy to say. We'd rather you say, yeah, that's the popliteal fossa behind the femur there. And that popliteal fossa contains the extension of the femoral artery, which is now popliteal. All we've done is said the continuation is now referred to as the popliteal artery. Now, what happens to it? See, it might be easier to do over here. Yeah. What happens to it? It has to get from behind here to supply this part of the limb. That being the case, what's the big bone over here? The smaller bone? The fibula. So there's a space in between that fibula and this tibia. And emerging through that space is an artery. And that artery, see, look at there, I can put the probe through there. So now that extension of the popliteal artery passes between those two bones, comes up on this surface of the tibia. And since that surface of the tibia is cranial, we'll call the artery the cranial tibial. We'll follow that down here till we get to this part of the limb, which is called the pes. And now we need to add an adjective word to make it, it's on this surface, which is dorsal, and it's a dorsal pedal artery that's right across here in a little triangular shape there on your cadaver. You'll be able to find it there, and then that continues as digital. So our intent is that you recognize that as the femur, and that continuation as the popliteal, that this subcutaneous vessel is the saphenous artery, vein, and nerve, and that in caps you will use that vein for venipuncture. And then as we follow that popliteal artery, we know that's going to go between the bones, come up on the cranial surface here, create the cranial tibial artery, which by definition says there's a caudal, but it's real tiny and we don't care. And we follow this cranial tibial down to the foot and have a dorsal pedal and continue as digitals. And that's enough on vessels. That's probably sufficient, isn't it? Now, there's something else I was going to say about vessels. Yes, there is a caudal tibia, quite small. Yes, there are other named vessels. Yippee. And the last thing that we needed to consider was, when we roll this over vascular-wise, we have veins that are draining blood this direction, and here we have a rather large lateral surface, and we use that same name as we did on the medial surface. Lateral saphenous vein. Now when you stick a needle in this dude and squirt the juice in there, we follow that vein. It doesn't go over here, it goes up here and joins a femoral vein just above that popliteal extension. So a slightly different drainage pattern, but the same name is used. Lateral and medial saphenous. I don't know that where they go is all that important. They go to the heart, and that's what you care about.
What exactly is the point of confluence on that?
The point of confluence is where they come together. So
okay.
The point of confluence would probably be the distal caudal femoral vein. And that would lead to the femoral vein, and then the femoral vein leads to the...
External vein.
Where does it lead?
External vein.
Femoral vein? The iliac veins, and then that leads to the...
Caudal vena cava.
Veins. Yeah. Caudal vena cava, and that leads to the...
Heart.
All right. Seems so long ago, doesn't it?
Do you start calling the vessels femoral outside the femoral ring?
Outside the, yeah, once I see it there.
Okay, before the femoral ring you call it external iliac?
Yeah, because the first branch off of the external iliac is the deep femoral. And we haven't spent much time looking at the deep femoral. Well, we spent a little bit of time looking at it. Deep femoral gives rise to the pudendo epigastric trunk. And you remember pudendo epigastric trunk gives rise to what vessel that supplies the mammary glands?
Epigastric.
Yeah, caudal superficial epigastrics, or that pudendo epigastric trunk. The epigastric part gives us the epigastric vessels. be they wedged in the muscle or be they on the surface. And the important one of that is the supply to the mammary glands. They call them superficial epigastrium. How long did that take?
Oh.
It's 20
30 minutes.
30 minutes?
Yeah, 20.